All right. Thank you, Dr. Hall. So next up, we have Dr. Reza Sanozi. So I'm so pleased that he was able to join us today. He's an assistant professor of medicine at Harvard Medical School, and he's an attending physician in the nephrology division in the Department of Medicine at MGH. He attended medical school at Georgetown, like me, go Hoyas, and he was elected to AOA there and graduated first in his class. He did his internship and internal medicine residency at Johns Hopkins Hospital, and then he completed his nephrology fellowship at the combined program of the Brigham and Women's Hospital at MGH. And following his training, he joined the faculty of Harvard Medical School, where he's an assistant professor, and his primary clinical and research interest is in improving the care of patients with vasculitis and glomerular disease. So we're so lucky to have him here, and it's wonderful to be able to share patients with him. So thanks so much, Dr. Sanozi.
Okay, hello everyone. I'm Reza Sanozi. I'm a kidney doctor at Mass General, and I love the kidneys, or as we like to affectionately call them, the beans. So it is a privilege to get to speak to you all today about them. So I'm going to divide my talk by first talking about kidneys in general, just to demystify them a little bit, because they're very mysterious, just like kidney doctors. And then I'll talk to you about how to prevent CKD, which I'll go into more depth soon. So chronic kidney disease, or CKD as we call it, is when your kidneys are working less than normal. It's a very simple definition. So first, to understand that, we're going to understand what do kidneys do and what are the kidneys. So the kidneys are two bean-shaped organs, usually the size of one's fists, that are in the abdominal cavity towards the back, and all the blood goes through them. It gets filtered, and then you see it goes down and makes urine and goes into the bladder. And the kidneys act like twins. Okay, so a lot of people ask, like, is this affecting both my kidneys? And yes, usually whenever something affects the kidneys, it affects both of them the same way. You know, so we think of them as one unit. So what do the kidneys do? They clean the blood. So that entails they remove waste products, they remove extra fluid, they remove extra acid, and they keep the water, salt, and mineral concentrations normal in your body. The second category of their function is they secrete hormones. And so some of the things that they do with these hormones are, for example, they control your blood pressure. And one of the main ways they do that is making a hormone called renin. They help make red blood cells, and they do that by creating this hormone called erythropoietin, which works on the bone marrow. And they keep your bones healthy and strong. And they do that by activating vitamin D. So you can get vitamin D in your diet or through the sun, but it won't work unless your kidneys are functioning. And lastly, another function that is not often known about is that they're very important in controlling your blood sugar levels. So the liver is the main one, the organ that does that, but the kidneys play a role in that too. So that's what the kidneys do. So I'm going to spend a little bit more time on that first function, which is about the blood cleaning. The kidneys filter all the blood in the body. Therefore, kidney function, this term that doctors use, your kidney function, is measured as a filtration rate. And we call it, the technical term for this filtration rate is called glomerular filtration rate. Okay, we call it GFR for short. So the reason we call it glomerular filtration rate is because the filter of the kidney, the actual part of the kidney that is doing the filtering, we call that the glomerulus. Okay, it's kind of a mouthful, but we're good at creating mouthful words. And what it is just, it's pictured on the bottom. Let me see if this has okay. So this is the glomerulus, and all it is it's a ball of tangled blood vessels. That's it. And these blood vessels are unique in the body because the walls of the blood vessels in the glomerulus, meaning in the kidney filter, they have holes in the walls. Okay, that's different than the rest of the body. The rest of the body, the blood vessels are all sealed, the walls are closed, so your blood's not leaking out everywhere. But in the kidney, there are holes, and the blood passes through these holes intentionally, and that's the purpose, and that's the filtering process. And then it goes into this space here, and then goes out there, and it goes to this yellow tubing, and that goes into the bladder, and that's urine. Okay, so that's the glomerulus, and that's why I call it the glomerular filtration rate. So we cannot usually directly measure the GFR of an individual. So we estimate it with a blood test called creatinine. So this estimation of one's GFR, we call it the estimated GFR or the eGFR. So you'll see that on a lot of your blood work. And just to be clear, creatinine is a harmless molecule that's released from the muscles that we use it to calculate one's eGFR. Okay? So I'm going to go back to the top of the slide and I'm going to repeat it, but I'm going to elaborate a little bit more because this is important. So as I was saying, we cannot directly measure one's GFR. We usually can't. We can if we wanted to, but that involves an individual going to a physiology lab and getting a lot of different blood tests and urine tests and injections and spending time. And that's very complicated and not practical. Okay, but if we wanted to, that's the original way that we would measure someone's GFR. So it just so happened that we, as a scientific community, came upon a molecule in our blood that's released from muscles called creatinine. Okay, the creatinine itself is inert. It doesn't injure or harm or benefit you, but it's unique because most of it is filtered. So if you measure in the blood, if you see that there's a lot of creatinine, it's a symbol, it's a surrogate marker that the kidneys are filtering less. So once we measure the creatinine in the blood test, and then there's a mathematical formula, we put it into the mathematical formula, and we put in usually the individual's weight and their age, and it spits out a number, which is the eGFR that I just told you about. So on any blood test results that you look at, you'll see a creatinine, and then you'll see an eGFR, right, usually next to it. And those go together. So you get the creatinine, and then the eGFR just puts it in a number that is more understandable, okay? So if your creatinine level is high, that means your GFR is low. If your GFR is low, you're said to have reduced kidney function, meaning you have chronic kidney disease, CKD. Now the term CKD, if you have a diagnosis of CKD, it doesn't specify what caused the reduced kidney function. It can be from anything: diabetes, cardiovascular disease, high blood pressure, drugs, medications, or vasculitis. So now I'm going to spend some time speaking a little bit more about GFR, and explaining the numbers behind them. So all of us, humans in general, are born with more than 100% kidney function. That's just a biologic fact. For some reason, we have extra kidney function, backup reserve. You don't need all of it. Okay, it's more than 100%. Okay, that's why a lot of us can donate a kidney and still live your life perfectly fine. Okay? In fact, so 60, anything more than 60, doctors generally don't care about that. Okay, sometimes we do, but in general, more than 60 is not concerning. It's considered normal. I'll add a nuance to that in a minute, but generally we consider more than 60 fine. So most of us in the room don't have 100% kidney function. I may not. Okay, so I want to just to be clear about that. In fact, it's normal to lose kidney function as you age. It's expected, it's normal, it's kind of like your eyesight. It goes down as you get older. Now, 30 to 60 is a reduced range of kidney function, and that's when most doctors start to care about that range, 30 to 60. Okay, 30 to 60% kidney function, we call it reduced. That's when we start calling it chronic kidney disease. It's called stage 3, but that's really when we start caring in practice. We care about it. And so even though it's low, in general, usually and typically, there are no consequences to the rest of your body when you're in the 30 to 60% range. Sometimes there is, when you're closer to 30%, there's somewhat of a higher risk of having cardiovascular disease. But in general, your body can function and your kidneys can keep up with your body's demands in that range, 30 to 60%, even though it's reduced. Then going 15 to 30%, that next range, that we call that chronic kidney disease stage 4. And in this range, you usually have a tendency for consequences of a reduced kidney function. Okay, so you have a tendency. So maybe not everyone has the consequences of low kidney function in this range, but you will have a tendency. And when you do have it, we usually manage it with pills. So what are those consequences of low kidney function? So I'm going to come back to this slide to explain the rest, but just to bounce off of that, the consequences of kidney function that is too low, electrolyte imbalances that interfere with your heart and nervous system, toxin buildup, you tend to feel terrible most of the time, acid levels build up, you become anemic, your bones become weaker, and you have a risk of becoming malnourished. Okay, so when your kidney function is very low, these are the consequences. So going back to this slide, there may be a tendency in that range, but it's usually very manageable. And so that's 15 to 30%. Below 15%, we call that kidney failure. And this is the range in which your kidneys cannot keep up with your body's demands. And in this range, a lot of people start to need a machine to take the place of your kidneys, to do what a kidney normally does, which is dialysis. So that's usually less than 15%. In fact, it's usually around 10%. But some people, they can be at 6%. And they're still able to keep up with their body's needs and they don't need dialysis. Other people, they may need it around 12, 13, or 14%. So it's individualized, but that's the general range, so you have some perspective. So some of you may have CKD. Your vasculitis may have attacked your kidneys and left it with damage, which is a technical term we use, damage, meaning scar tissue from the attack. This is resulting in a permanently reduced kidney function, CKD. And yes, the absolute level of your GFR is important, meaning the numbers I just showed you on this figure. It's important for all the reasons I just told you. However, equally important is the stability of that GFR. So to give you an example, someone may have a GFR of 20, and that's low. And so we're going to obviously care about that. But that person may have that GFR at 20 for decades. and they live their life. Compare that to someone whose GFR is 80 in the normal range, and the next day it goes to 50. Okay, 50 is way better than 20, but that instability, I'm more concerned about that second patient or that second person compared to the first one because of the instability. And so that's what I'm going to talk to you guys about, which is how to keep your GFR stable, which is another way of saying how to prevent progression of chronic kidney disease. So I have attempted to keep it down to 7 steps. Step 1, which is the main way, is prevent relapses of your vasculitis. Because if the vasculitis attacks the kidney, it usually will result in more damage. And even if you treat the relapse, you're oftentimes left with more damage after that relapse. And if you're starting out at 30 GFR, you may be left at like 20 after another relapse if it affects the kidney. Or 20, and then you go down to 10, and then you're at the higher risk zone for dialysis. So, if your vasculitis originally affected your kidney, then it's a very pressing issue to monitor the kidneys to make sure they don't attack the kidneys again. But a point to keep in mind is that even if it didn't originally affect your kidneys when you first diagnosed with your first flare, it's possible that it could affect it in the future. It's less likely than the ones who had it originally, but it's still possible. So what do you do? Well, the practical thing that you do is you just follow up with your doctor. Just show up. That's your part. Then the doctor does their part, and you guys work together as a team. Okay? The risk of this is when someone just says bye forever, and they don't see a doctor, no one's checking their labs, checking how they're feeling, and they come back years later with a relapse. And so if you just show up, you've done your part, and then the doctor can do their part. And the point of this talk is not necessarily to go into all the ways of keeping the vasculitis away, but just suffice it to know that there are a handful of different medications that can keep vasculitis away. And not only are there a handful of different medicines, but there's many different ways to use the same medications. And this is where that conversation happens with your doctor. Okay, step number 2, improve your cardiovascular health, because the healthy blood vessels usually equates to healthy kidneys. In other words, the quality of your blood vessels in your whole body is connected. The quality of your blood vessels, whether it's in one area or another, the kidneys they have those same blood vessels. So you want to take care of your whole cardiovascular health because your kidneys have that vasculature system in them. So one way to do that, a very straightforward and should be the first step, is do not smoke, because the smoke creates a lot of free radicals, and that generates a lot of inflammation and damages your blood vessels, and the quality of the blood vessels go down, and that can damage your kidneys in addition to the rest of the blood vessels in your body. Okay? Step 3, improve your cardiovascular health. And in this time, through your nutrition. So the best thing that I can recommend for you in this area is to discuss with your doctor about nutrition and the diet that's right for you, and specifically if a nutritionist referral is warranted. Because in general, a plant-based diet, meaning less red meat, and a diet that's rich in fruits, vegetables, legumes, fish, poultry, and whole grains, it's healthier for your cardiovascular system. And that benefiting your cardiovascular system will benefit your kidneys. And it's just so, you want to, everyone is different, but in general, more omega-3 fatty acids, meaning polyunsaturated fats, meaning things like fish and olive oil. These are things that we want more of, and less red meat and other processed foods. So that there's more nuance in exactly what might be right for you, but nutrition does play a very, very important role. Step 4, improve your cardiovascular health. And this time, by working to prevent metabolic disease. Metabolic disease is a term that we use for how your body handles sugar, fat, cholesterol. And one way you can do this is through regular exercise. And one of the aims of regular exercise, in addition to just moving your body and being active, and just the inherent benefits of moving your body, is weight control, because the obesity promotes metabolic disease. So regular exercise is it's fundamental. It doesn't have to be involved. You don't have to go to SoulCycle. You can just do brisk walking, and I think the foundation of success comes through consistency. So if you're doing brisk walking consistently, then you're going to derive so many benefits from that. So that's step 4. Step 5, improve your cardiovascular health. And this time, by preventing or controlling, if you have it, diabetes. So what do you do practically is, if you do have diabetes, follow your doctor's guidance on controlling your blood sugar levels. Be mindful of how important controlling your blood sugar levels are. And whether you have it or you don't, regular exercise, weight control, and nutrition, touching upon the things I just mentioned, will all help reduce your risk of developing diabetes. And this is important because diabetes, it can be very stressful and damaging to your blood vessels. And the blood vessels, as I mentioned many times already, the health of your blood vessels determines the health of your kidneys. Now, step 6, again, your cardiovascular health, and this time by controlling your blood pressure. Blood pressure is very important for the kidneys. So what I impart to you to do about this is to limit your processed foods, because most of the salt, the goal is to reduce how much salt, or to not have excessive salt in your diet. And most of the salt in our diet, in our society, comes in processed or prepackaged foods. So if you just be mindful of that and limit it, that's a big step in the right direction. And then to follow up with your doctor about this, because they can actually track your blood pressure and make sure it's appropriate. And they may use certain medications if your blood pressure is high. There's a variety of different blood pressure medications. A couple of them have been shown to be really helpful to protecting the life of a kidney and to extend the life of a kidney, which I named them there, the ACE inhibitors, which is a class of medicines, and the angiotensin receptor blockers, again, a related, similar class of blood pressure medicines. And so your doctor and you can decide if that's right for you. And lastly, step 7 is to control, I wrote here, control acid levels in your blood. And really what you would do about that is just follow up with your doctor. Because if you have chronic kidney disease, as I mentioned, you have a tendency to build acid up in your blood. And it's been shown that too high of an acid level, even if it's, yes, it's a consequence of the kidney disease, but the acid itself can go back and damage the kidney more and be pro-inflammatory or promote inflammation. And so if you follow up with your doctor, they will discuss with you based on your levels if you need something like a baking soda pill, because the kidney, a normal kidney makes baking soda. That's how it controls acid. Okay, it makes sodium bicarbonate, which is baking soda, and it releases it into your blood. And if your kidneys are not working as well, they may not be able to make as much. So we just do a simple fix. Give them some arm and hammer. Okay, that's so, and we give it in the form of a pill because it just looks better. Makes us feel important. So, in summary, you prevent relapses by following up with your doctor regularly. And I've kind of drilled in how important cardiovascular health is. Avoid smoking, proper diet, regular exercise, control your blood pressure, prevent or control your diabetes, and see your doctors regularly to monitor your labs. And that's all I have to say. So thank you for your attention. Any questions or comments?
Hi,
Yes.
my name is Marcus. I have two questions. Can you drink too much water? Like, is water, is there a threshold beyond which you shouldn't exceed? And does exercise exacerbate, too much exercise exacerbate, your kidney function? Is it detrimental?
Yeah, those are great questions. So water, I would, in general, I would advise, I'll take a step back. There's this notion out there that the more water you drink, the better it is for your kidneys. And there are a couple conditions, medical conditions, where drinking more water is better for your kidneys. That includes like having a kidney stone. We ask people to drink more water. Or if someone has recurrent urinary tract infections, we ask them to drink more water to flush out the bacteria. And there are a few other examples, but outside of those examples, in general, for most people, drinking more water is not necessarily going to be better or healthier for your kidney. So I generally advise just to follow your thirst, because your brain is exquisitely sensitive to tell you if you need water or not. So if you're thirsty, follow that instinct and go drink water. And if you're not thirsty, you don't necessarily need to. Now, can you overload, in general, if you do drink too much water, your kidney is just gonna pee it all out almost very shortly after drinking it. But can you overdo it? Rarely. There are situations where the answer is yes. If you're an otherwise healthy person, that's like, drinking gallons. And sometimes you might be at risk for drinking too much water, that it won't necessarily hurt your kidney, but it can dilute your blood too much, and that's bad for your brain. Okay, so that you usually have risk factors for that, like you're on certain medications, but so that's a little bit individualized, but I guess and that may require like a conversation with your actual doctor, but for most people, no, you can't, you just the general water that we have throughout the day, you can't overdo it. So that's part A. Part B, with the exercising too much, in general, no, but if you take it to an extreme, it can. And that's if you do something that, and this is usually like an extreme situation, but if you, like a ultra marathon runner, or you just kind of push your muscles to the maximum, your muscles can break down. We call that rhabdomyolysis, and it releases chemicals that injure your kidney. Okay, so that's, but for the average person who works out, I don't want to send the message that, like, you're at the gym, you're just doing your thing, and it's like, no, I can't overdo it. I don't want my kidneys to get hurt. Like, if you're just doing the normal thing at the gym, then it won't be too much. Thank you. Anything else? Yes.
My name is Rose, and I had just a simple question, because there are certain people that love to live on Gatorade, and that's an electrolyte solution. So plain water versus Gatorade all the time, I don't know that that's needed all the time.
Yeah.
Can you speak to that?
Yeah, so That's a great
Thank you.
point. I've seen that too. Gatorade, yes, there are electrolytes in it, but the amount of electrolytes in it are so tiny that from a doctor's view, from like a physiology view, we pretty much just call it water. That's how little it is. And so to me, Gatorade, the benefit, if you needed a benefit from Gatorade, is that it has sugar in it. So maybe an athlete needs sugar to kind of enhance their performance. But outside of that, I generally don't view it as something like extra special. I view it as almost the same as water, but with sugar. So it can have its benefits, but I don't. Sometimes it can be over marketed. You're welcome. Okay. All right. Well. Oh yes. Yeah.
Sorry, I'm Chris. I'm here supporting my wife. But in follow up with that, especially when you talk about controlling, excuse me, diabetes, my doctor advised me away from things like Gatorade because of the sugar content. So I think anything in moderation, but the water is probably the best, safest bet out there, as long as you don't think you're going to drink like 5 gallons of it at a shot and it's going to have some miraculous benefit for you. So.
Yeah, that was well said. Thank you.
I have a question. Oops. I'm Heidi. I have GPA and anti-GBM disease. When I had my disease, I was 10%, I was in kidney failure, and now I have 52 to 55%, 52 to 55 GFR. So
that's great. That's great. Good success story.
And no dialysis.
Yeah.
So does that mean the remaining glomeruli have kicked up and kicked in? And if so, why do we have millions of glomeruli if 70% of my glomeruli were sclerosed and the remaining few have now kicked in? And why do we have, millions if my few remaining ones are doing the job?
Yeah. So when you've recovered your kidney function, part of that is the glomeruli that were injured from the initial attack have healed. And then the other part is that the normal glomeruli that were less impacted have, as you said, kicked in and compensated and gotten a little bit bigger to deal with that. So it's a combination of both of those. And as far as why we have extra, I don't know the answer to that. That's just, it's like, why did we evolve to have that? And that would be like a teleological response, like just speculating. But yeah. What else? Okay, thank you again.